Yes, she's a psychiatrist with Healthway Medical, also an expert witness called upon regularly for that, an author of a book entitled Annulment in the Philippines, Clinical and Legal Issues, which is a hot topic here, of course. So please welcome Dr. J to the stage.
Good morning. My lecture is about recognizing anxiety at work. Okay. The signs and symptoms of anxiety are poor concentration, sleep disturbance, excessive worry, restlessness, muscle tension, irritability. So if you feel like your nape hurts and you keep massaging it, that's because you're feeling anxious. And this results to stress. Those that make you go to the doctor's clinics are the chest pains, the tensions, the panic attacks, the high blood pressure, the dizziness. But when people check you, when the doctors check you, and you're already in the clinic, the blood pressure goes down. So it's from your workplace, your blood pressure was around 180, 110. But then when you're in the ER already, it just goes down. You don't know why. But it's because when you're in the ER, you feel that there's somebody who cares, or there's somebody who's listening to you, or there's somebody attending to you. You're not in charge this time, and somebody's helping you. How about those who do shifting work? So these are the call center agents, and those that also do like outbound and all that. They come to the clinic because they stay up late. Well, their hours are very different, and their shifts are like every 2 weeks or every month. And this is study, there's higher serotonin level significantly in day workers, while those who work rotating shifts have lower levels of serotonin. What does this mean? Serotonin is the neurotransmitter that helps regulate our learning skills, our memory, and it also helps us sleep and rest and relax. But if you're more on the night shift or the shifting type of worker, your levels of serotonin are significantly lower. How do people manage stress? Stress is brought about by persons who are, you know that a person is stressed when they approach you with a frown, or they shout at you, or they criticize you. Or these are also the people who honk. It's because they're stressed. There's something bothering them, and they need to bring it out. So how do these people, or how do we manage stress? There's the immature and the mature defenses, and these are the common ones. There's splitting, projective identification, transitional object formation, and countertransference. Okay. These all take place in the amygdala, the fear center, which regulates fear, memory, emotion. Also, the amygdala coordinates with heart rate, blood pressure, and other physical responses to stressful events. If you watch this movie, everyone must have watched this movie, or most of the people in this room watch this movie. You would notice that General Luna was very, very emotional and stressed. Okay, so what defense mechanism did he use? He used projective identification. He used splitting. Splitting is all black and white, all or nothing. Okay, so we have to manage our anxiety. We have to know how to neutralize it. We cannot live with black and white and all or nothing. We have to learn how to compromise. We cannot be in extreme. We cannot think in extremes. Okay, so this is another coping mechanism, projective identification. If you've watched this movie, Fatal Attraction, it's about a mistress who is very interested in having a relationship with a very successful man that she looked up to. Projective identification is an unconscious fantasy of being forced in another person. So it's like you want that person to be yours, or it's like you're a vampire and you want that person's blood and that you're that person already. So in the end, this person who was using the coping mechanism of projective identification initially promised not to bother the wife and the family. But later on, when she felt rejected by the man, she started to bother the family and threaten. In the end, stabbing them. Trying to stab them, but she ended up killed. Okay, so we also use transitional objects as a coping mechanism. What are transitional objects? Well, they can be persons. For those who just broke up with somebody, they need another person to make them feel better. Or we can use pets or pillows or security blankets as transitional objects. There's some mature and immature coping mechanisms. So you have to choose what kind of transitional object and what you're gonna do about your transitional object. Because if you're just going to have another relationship for the sake of getting over the first relationship, it's not going to work. Okay. And another transitional object that is quite harmful is smoking. Smoking, according to Winnicott, illuminates how an individual manages the relations between the outer world and the inner world of a subjective experience. That's a psychodynamic terminology. But if you notice, smokers go out and then light a cigarette after they're scolded or after they're excited or after some tense event, they go out because they're trying to re-examine themselves. But actually, you don't really need that cigarette. You can just go out. But since this became a habit and the nicotine is also addicting, then that's why smoking is really very difficult to give up. So the persons come to the clinic, experience some sort of transference and counter-transference with the doctors. And it depends on the success of the relationship of the doctor and the patient, how the patient's symptoms improve. What happens when people are experiencing anxiety? They don't really think straight. These are those who are experiencing like panic attacks or when they are very angry already and they start destroying things. Or they say, I will kill you, or I will have them killed. You know, when you say those things or you threaten some people, it can always be used against you. To relieve stress, remind yourself that you are in control or you have a higher power who will take care of everything and all is well. And keep thinking, find a nice affirmation that you can keep repeating so that your whole body will continue to follow. Because your mind, remember, is the one controlling your body. when you're anxious, you tell yourself, I'm anxious, your blood pressure goes up. So it's your mind that you have to control. You have to remind yourself. If you feel like you're having a panic attack, a person who experiencing panic attack is a person who feels like he's out of control. Usually these persons are the ones who have a lost loved one, or a relative who recently died, or a relative who is sick, or a spouse who is sick, or somebody who is not around, who left your life for a month or two. Then you start getting these palpitations. You just tell yourself some affirmation that will make your body follow. You can also inhale for 2 seconds and then exhale. So why do you regain control of your body when you inhale for 2 seconds? Okay, so our brain has the voluntary and the involuntary parts. For example, we don't tell ourselves left, right, when we walk. Same with breathing. So when we inhale consciously for 1 to 2 seconds and then exhale, we are taking over or overriding the involuntary part of our brain with our voluntary part. Okay, so once that you're more relaxed and you start to remind yourself that there are good things that will happen. If there are negative things that are bothering you right now, it's just going to pass. It's not going to be there forever. The best way is to permit your mind to dwell upon the inferior and to surround yourself with inferior things is something that you need to avoid.